I would really like for them to understand what the beneficiaries are going through, what the beneficiaries don't understand. You know, they're just sitting there hoping that somebody will be an advocate for them. They don't even know how to fight for themselves. I feel like I become a patient advocate. I'm fighting for them. They don't even know how to fight for themselves. I wish that there was a better way for documentation to be reviewed. I mean, why are we denying over clerical errors? That's ridiculous. If the medical justification is there, they deserve that equipment. If your patient is quadriplegic and they can't walk, why are you denying them their chair? Why? I have a patient that has a chair that's fixed together with duct tape and rope and an old piece of cloth because she got stuck in the changes of Medicare and she had to start all over again. She's my age. She's a traumatic brain injury. She's dependent. She's still waiting on her chair. Her mom and dad are tying that chair up with rope and duct tape. And it's frustrating to have to see somebody go through all of that. And this mother and father have devoted their lives to their daughter, and they're doing everything they can, and they're still waiting on Medicare to approve her chair.
Thank you.
You're welcome. We have a section of audits that will be coming that we're preparing for with the general equipment, standard equipment, and then custom equipment. So I'm going to kind of break it down because there's a little bit of difference between the two. As far as your general equipment, when I was a treating therapist, I would actually write the prescription. The doctor would sign off on it, and as long as you had the correct diagnosis, maybe a little backup documentation that they need a walker to be able to walk, they need a wheelchair to be able to get around safely, I would submit that to the company and the equipment would show up, patient goes home, no problem. And now, well, since July 1st, with Medicare patients, they actually require a face-to-face with the doctor. And then every single item on their wheelchair needs to be medically justified as if it was custom. And these are people that are leaving the hospital. They need to go home with this equipment. Mm-hmm. And now the doctor has to see them face to face. If they're getting a high strength, lightweight wheelchair, let's say, with elevating leg rests, those elevating leg rests have to be medically justified and documented. Height adjustable armrest, medically justified. A general use cushion, general use back, a seat belt, anti-tippers. So I have to have this conversation with therapists and doctors to say, hey, look, you can't just send me over a prescription anymore. Mm-hmm. You have to have all this medically justified and documented, and the physician has to sign off on all of this prior to delivery. Mm-hmm. So what is that doing? Mm-hmm. These patients are waiting for their equipment, and we're waiting on documentation. Mm-hmm. And so they can't leave the hospital when they need to. Mm-hmm. They can't go home with the proper equipment. And so then it actually puts the burden on the patient. Hey, look, we can bring this equipment, but we may not be able to bill your insurance. You may get a bill for your equipment. Mm-hmm. And they look at us thinking, why do I even have insurance? I have Medicare, it should be covered. Mm-hmm. I just had hip surgery. Why should I have to pay for my medical equipment? Mm-hmm. So that's the one frustration we're running into with those new requirements. Those audits have not started, but I know they will. Mm-hmm. And then I'm going to jump over to customized equipment. The timeline has really increased because from start to finish, we as vendors have to make sure that all the documentation is correct to submit it to Medicare. So a patient has to see their physician, and either the physician or a physical therapist or occupational therapist needs to do a seating evaluation. All those items need to be medically justified as well. And this type of documentation is even more in depth than what we're having to do for the general equipment. And it has to be perfect. I mean, literally perfect. If I sign my name with my first initial and my last name, it gets denied. I mean, everything could be there. It could be a perfect document to support the need for that equipment. But if I put T. Rodriguez, denied. Who's T. Rodriguez? We don't know her. So in the meantime, I'm having to have a conversation with the patient to explain to them why they don't have their equipment. And they're frustrated. They're depressed. They can't do what they need to do on a daily basis safely and effectively. I mean, imagine if you couldn't get dressed and take a shower and go to work because you didn't have the equipment you needed to do that. So we have these patients just sitting and waiting and hoping. And the other scary thing is they're using loaner equipment. So it's not customized to their needs. And what can happen in the meantime? Falls, skin breakdown, people develop wounds, and it sends them back to the hospital. And then we're paying hospital bills. Why not cover the equipment now that they need so they don't have to go back to the hospital? Why put them through this? They've already been through enough in their life to be in a position where they have to depend on equipment. Why put them through more? And I try to do my best to educate the therapists involved, the physicians, and the patients. But I feel like I spend most of my time doing that versus really focusing on the patient. And that's not why I do what I do. I don't want to be a Medicare educator. I want to take care of my patients. I want to help them be more independent.
You had an opportunity right now to speak out to Congress. What would you like to say to them about the